Hi, welcome to Point of Care Nursing. My name is Gozi, and in this video, we're going to talk about cardiac tamponade for the CCRN exam. So, cardiac tamponade is a situation where the pericardial space of the heart is filled with fluid, and this fluid is causing problems hemodynamically. It's making the patient hemodynamically unstable, meaning that there's difficulty with cardiac output and cardiac feeling. So the heart is finding it difficult to pump blood out of itself. And at some point, there's going to be difficulty with feeling because the fluid around the heart is restricting the heart's movement. So it's restricting that expanding and ejection action of the heart. It's restricting the pumping action of the heart, basically. So blood is accumulating in the heart. It's difficult to get this blood out. At some point, feeling will get difficult because where's the blood going to go if the heart is already full? It's going to start backing up. So yeah, this is how the patient gets hemodynamically unstable with cardiac tamponade, and then cardiac output and cardiac feeling are affected. Some causes of cardiac tamponade are cardiac surgery. So talking about the cabbage patients and the cardiac trauma patients, those surgeries could put a patient at risk for getting cardiac tamponade. A patient could get cardiac tamponade after having a myocardial infarction because they could develop pericarditis. There could also be rupture of the heart itself in places that could cause to leakage of blood out of the heart and into the pericardial space. Some viral infections could cause this. Bacterial infections could cause this as well, including fungal infections. So medications can cause cardiac tamponade. Some of these medications are procainamide as well as hydralazine. CPR could cause cardiac tamponade, and electrical cardioversion could cause cardiac tamponade. These are just some causes of cardiac tamponade. Now, how does a patient with cardiac tamponade present? Before I jump into it, two things we need to know for the CCRN exam regarding cardiac tamponade is that the patient may present with pulsus paradoxus as well as a narrowed pulse pressure. We calculate pulse pressure by subtracting the diastolic blood pressure from the systolic blood pressure. It should give us a value of 40, 120 minus 80. You have a narrowed pulse pressure where that number is lower than 40. In the case of a patient with cardiac tamponade, systolic blood pressure is lower. So when you subtract the diastolic blood pressure from the systolic blood pressure, you get the number that is lower than 40, and this is how we have narrowed pulse pressure in cardiac tamponade. Talking about pulsus paradoxus, it's a case where when you compare the patient's blood pressure during inspiration when they're taking a breath and expiration when they're letting out a breath, there is a decrease in the blood pressure during inspiration when compared to the blood pressure during expiration. So the patient already has fluid around the heart. The heart is already restricted, it cannot move well, the motion is impaired. Now add that to increased pressure when the patient takes in a breath. There's now increased pressure in the heart that's further restricting the heart from pumping as it should. This is where we get this drop in systolic blood pressure during inspiration when the patient has cardiac tamponade. So those are the two things you need to know for the CCRN exam. Now, the patient with cardiac tamponade is going to present with anxiety. They might report feeling an impending sense of doom. They may be agitated, restless, anxious. Patient might complain of chest fullness, chest discomfort, or chest pain. The patient might also complain of shortness of breath or trouble breathing. That gets better when they sit up. When we conduct our assessment, when you do your assessment on the patient, you might find out something called the Beck's triad. The Beck's triad is when the patient is hypotensive, the patient has distended neck veins, or the patient has, or and it's three things, and the patient has muffled heart sounds. So that's the Beck triad regarding cardiac tamponade. So for the patient with cardiac tamponade, when you put your stethoscope on the chest to listen, you might find that you're having difficulty hearing the heart sounds. The heart sounds might be muffled. That's because of this fluid around the heart that's absorbing that sound and preventing it from propagating as it would usually. Um, Patient might have distended neck veins. If the patient has become hypotensive, we might not see any distended neck veins. Now, if this patient came out of surgery, any kind of heart surgery, and they have chest tubes in place, it's important to also assess those chest tubes to make sure that they've been draining, that they are draining like they were draining previously. So if it was draining very well before and now suddenly there's absolutely no drainage, that might be an indication that the patient has cardiac tamponade. If you can't hear heart sound and the patient is suddenly hypotensive, the patient might be retaining fluid in the chest cavity, and that fluid might have gone into the pericardial space around the heart. Now, for to determine if the patient has cardiac tamponade, the providers could do some imaging studies. They could do a chest X-ray. It could show a dilated superior vena cava because blood is backing up, an enlarged heart, of course, because there's fluid around the heart. If you do an EKG, there'll be diffuse ST segment elevation across the precordial leads. Patient might be bradycardic, and patient might have ventricular dysrhythmias. You could do ultrasound of the heart to see what's going on. You could do a CT of the chest to see what's going on. Now, the patient might code. The patient might go into cardiac arrest. In this case, we would prepare or we would start CPR on the patient, maintain airway breathing and circulation. And the usual treatment for cardiac tamponade is pericardiocentesis. So we would prepare the patient for pericardiocentesis. This is like the nursing interventions for the patient with cardiac tamponade. This video has come to an end. I hope you found it helpful. This video was for cardiac tamponade for the CCRN exam. Please like, share, and subscribe, and I will see you in the next video. Bye bye now.